The National Tuberculosis Program is expressing concern over the high number of TB patients who have failed to access medication since the onset of the pandemic. This comes as data reveals 60,000 TB patients cannot be traced, which puts hundreds at risk of contracting the disease. They are also raising concern over the decline in funding by the Global Fund towards fighting TB.
According to the Kenya Conference of Catholic Bishops Technical Advisor on TB issues, Michael Masharia, Kenya was among 30 countries in the world that had a high TB burden. He attributed the high number of victims who were not undergoing treatment to poor quality screening at community levels and stigma.
That report, the one thing you would notice, other than being among the 30 high burden TB countries in the world, Kenya also ranks as among the top 20. As far as TB, HIV, and MDR-TB burden is concerned.
During a meeting by members of Kenya Conference of Catholic Bishops, the National TB Program and officials from 9 counties who met under the Commercial TB Program in Naivasha to address the disease after the pandemic, Masharia noted that funding from Global Fund was on the decline, affecting set interventions despite the Ministry of Health increasing its allocation towards fighting the disease.
The country had a TB incidence of around 146,000 TB cases. Of that, we are only able to identify 86,000 cases. So if you do the math, you realize we missed around like 60,000 cases as far as TB is concerned. Is that a concern? Yes. Why? Because these cases are in the community.
He noted that stigma and the number of defaulters were on the rise, with the country reporting 692 cases of multi-drug resistance last year.
And the one thing that we know, there are a few things that will contribute to those. One of them being quality of screening in our facilities. The other thing we know that also contributes is also the stigma that is associated with TB, where sometimes people feel that TB, if you have TB, for example, you also have HIV. So that in its essence also makes people not seek health services.
The pandemic, according to Hazel Oyungu, who is also a program officer, the pandemic had affected the fight against TB as patients shy away from health centers. Beatrice Getonyang-Etich, Channel 1 News.